motorists. Okay, thank you. I'll ask my questions, but we can have the answers in writing. So the first is between the Vitality and Horizon networks. Are there budgetary imbalances? The funding that's made available to one or the other. So are people better paid in one as opposed to the other? Because we often saw that in other places. My second question has to do with the exams taken by French language graduating students. There's the NCLEX exam that people take. So did this new program have positive impacts for your network? That's my question. Would you like to respond, Dr. Desrosiers? Yes, I can start answering, if that's okay. When it comes to equal pay, all salaries are managed by the Treasury Board in New Brunswick, so it's provincial. And in theory, it should be about the same. But when it comes to audits and verifications and compliance with directives from the Treasury Board, that's another question. As far as I know, there hasn't been a general verification to compare one network to the other. When it comes to the budget, it's yet another excellent question because there's no clear formula for the allocation of the budget in New Brunswick. Even if there is one, I'm not aware of it, and I've been asking the question for a while now myself. So what would be a fair budget? What would it be based on the percentage of Francophone and Anglophone populations, or will it need to be adjusted to recognize the different circumstances of the Francophone populations or the greater needs in terms of health services coming from the Francophones in general, or even as a third factor, the fact that Vitalite, the network, needs to contribute to the formation of Francophone professionals. And when you look at the numbers of bilingual healthcare professionals hired by both networks, so a fair formula wouldn't be 68 to 32% based on population. So we will need to think more about this question.
As for NCLEX, the test for graduating nurses, there's been major improvements in recent years. As for translating tests and study tools, my understanding is that the success rate for Francophones is roughly the same as that of Anglophones, or at the very least is improving. Now, we don't necessarily have data on the number of Francophones who rate the test in English because they're more comfortable in English. We don't know about their success rates. And so we lack some data there.